4 different types of fitness that we are going to concentrate on and that really we should be incorporating into our workout routines every week. One of them is cardiorespiratory fitness, which is just what you think of when you think of cardio types of exercises. The second one is resistance exercise, which is doing anything that is either body weight or utilizing weights to try and add resistance to the body. The third one is flexibility, and actually that is considered a type of fitness. And I'm willing to bet many of us need to work on a little bit more unless you happen to frequent the yoga studios. And then the fourth one is a kind of a newer up and coming one just in the last several years, which is neuromuscular fitness. So I'm going to spend the next several days kind of going into those topics a little bit more. So when we talk about fitness, we kind of can talk about a plan for fitness utilizing what's called the FIT principle, which stands for F is for frequency, so how often you're doing it. I stands for intensity, so how hard you're working. T stands for time, which is the duration on how long you're exercising, and the other T stands for type, which is the type of exercises that you want to do. So today I want to spend a little bit of time talking about cardiorespiratory exercise, our cardio exercise, and talk about how we should be fitting that into our workout routines using the FIT principle. And as we mentioned earlier, there are different goals people might have. One could be just being healthy. One could be that you actually are trying to become fitter, or one is that you're actually trying to lose weight, or some kind of a combination of all of those. Well, how we actually incorporate cardio or the other types of exercise into our routines is going to largely depend on what our goal is. So I'm hoping to kind of cover cardiorespiratory today and talk about what are the best ways and frequencies and intensities that we should be exercising with our cardio in order to hit the goal that we're trying to hit. So starting off with healthy, as far as what we want to be doing if health is our goal for whatever we're working towards for our cardiorespiratory exercise. So the frequency of how often we should be doing it, the recommendation is actually at around 5 days per week, unless we bump up our intensity, but I'll get to that in just a moment. So about 5 days a week, they want us to be exercising just for our health benefits. Our intensity, there's 2 different ways that we can count intensity that are easy to do. One of them is called the talk test, which means that if you were working out with somebody else, you could be able to carry on a conversation with them, so you're not going so hard that you can't talk. However, if you tried to sing a song out loud, you wouldn't be able to belt out the song. That actually takes more lung support to be able to do that, and the harder we're working, we're unable to do that. So if we're going for health, the idea would be to be able to talk but not be able to sing out loud, and that's the intensity level we would be working at. Another way to rank intensity would be on a scale of 1 to 10, with 10 being the hardest exercise you could ever imagine doing, where you just couldn't even maintain it for very long, and 1 being you're sitting on the couch or not doing anything. The kind of range we would want to be in would be around a 6 to 8 on that scale, which means you're working somewhat hard to hard, and that's a good moderate intensity level. So if health is our goal, that's a good intensity level. As far as the timing goes, if you're operating at that lower intensity level and doing it 5 days per week, the time should be right around a half an hour for those 5 days, which gives us about 150 minutes of exercise per week, which is the goal when it comes to health. If we bumped up the intensity and actually started exercising like an 8+ on that scale, or where we couldn't sing, we could actually cut down the number of days a little bit, but intensify and cut down the time as well. But because we've increased the intensity, that actually makes up for it. And so you could do 75 minutes for the entire week, which could be in like 25-minute sessions 3 days a week if you bumped up that intensity level. As far as the type goes for health, it really doesn't matter. It's whatever you enjoy doing, and that's the type of cardiorespiratory exercise you should do, which really is anything that gets your heart rate up and gets your breathing up. So it could be walking, jogging, biking, swimming, anything that just increases the cardiovascular system, anything that makes your heart rate raise and you can sustain for that period of time. So those are all if our goal was to be for health. Now, if our goal was to increase fitness and actually become fitter or more athletic, then we might actually change this prescription just a little bit. So for instance, we would probably want to add another day to our exercise regime. And so our cardiorespiratory exercise, I'd probably increase and make sure it's at least 5 to 6 days per week. It's okay for you to take a rest day. You don't have to exercise every day and wear out your body that way. On our scale of 1 to 10 or our intensity level, we could be operating at that 6 to 8 level, again, somewhat hard to hard. And then every once in a while, like maybe once to twice a week, I would bump up that intensity level to be at least above an 8 or a 9, which means you're starting out for most of those 5 days, maybe like 4 of those 5 to 6 days operating at that I can talk but not sing, and then for 1 to 2 days bump up that intensity level to be where I couldn't even sing or couldn't even talk while I was exercising. So you're actually getting that heart rate up pretty high at that point. As far as the time goes, we will increase our time of exercise a little bit if athleticism and fitness is what our goal is. So anywhere between a half an hour to 60 minutes is a really good range for us to be able to do. And if as far as the type of exercise we're trying to do, if you're training for something very specific, we would suggest you actually do whatever that thing is. So for instance, if you're trying to increase your speed for racing and running races, you would actually want to run in order to do that exercise. It is nice to throw cross training in and doing a different activity like swimming or biking, at least maybe once per week, but you would want to specialize if that was what you were trying to do. If you're just trying to increase overall fitness, then do a wide variety of activities. So that was if you're trying to increase your athleticism or your fitness level. The last one is some of us are actually trying to lose weight. And the way that we will operate and kind of plan out our prescription is a little bit different for when we're going for weight loss. So for weight loss, the frequency, we should be doing cardiorespiratory exercise probably around 5 to 6 days per week. The intensity level, we actually can respond well to lower intensity levels when we're trying to lose weight. There's one caveat to that, which is high intensity interval training, and that's a topic all on its own that I'm actually going to cover tomorrow. But as far as a general prescription of what we want to do, it would be actually sticking in that, talking but not singing, and even on the lower realm of that where you could almost sing, or on that scale of 1 to 10, operating more around that level of 6 where it's just somewhat hard for you. It's a lower pace, but still getting your heart rate elevated. But how we compensate for that and how we actually lose the weight is increasing the time at which you're exercising, in which the recommendation is at least 60 minutes to 90 minutes per day. What that means is that I would go for a brisk walk for about an hour to an hour and a half each day instead of trying to go for a jog for a half an hour a day, or the equivalent of whatever fitness level you're at. So you come down in the intensity of the exercise, but you up it on how much time you're exercising. Now, when it comes to losing weight and the type of exercise that you can do, first and foremost, the recommendation is whatever exercise you are going to actually do, so whatever you enjoy. However, it's really good to vary the types of exercising that you're doing if you're trying to lose weight. So don't just stick to one. Do something like swimming and then biking and then walking and then jogging, skiing, playing tennis, whatever it is that you can do to get a wide variety of different types of exercises. and we want to keep them at a steady state at that time. So make sure that you've got a steady state of exercise going so that you're keeping that same level of exercise throughout that 60 to 90 minutes. Now, as I said, I am going to change this just a little bit tomorrow and give you a little bit more information on high intensity interval training, which has been shown to both increase fitness and our weight loss, as well as our health, but it's kind of a different realm of physiology that I'm going to go more in depth tomorrow. But this is just a long lesson for you today, but just trying to delve into what should we be doing for cardio and how does it change based on what my goals might be. So I hope you enjoyed. If you have any questions, always feel free to either private message me, or you can even ask them down below in the comments of this, and I would love to be able to answer them for the rest of the group. So this is kind of my specialty in what I do, and I would love to be able to help you in any way that I can. I hope you guys have a good day, and thanks for listening.